Nutrigenomics is an important area for public health. Let's look at how research in this area moves forward by understanding how sex and gender interact. This case studies the epidemic of non-communicable diseases, such as heart disease, diabetes, and cancers, on the rise across Europe and North America. Let's go to the case study, Health and Medicine and Nutrigenomics. Full case study. This diagram shows the relative influences of sex and gender-related factors determining a person's disease risk over her or his lifetime. Importantly, both gender-related social factors, such as obesity, lack of exercise, smoking, and the like, interact with sex-related biological factors such as genetic predisposition, birth weight, and hormones to determine how well you age. For instance, to understand differences in men's and women's obesity rates, we need to analyze gender differences in lifestyle. Perhaps gender norms in society lead men to exercise more than women. This can lead to greater disease among women. Or perhaps gender norms in society lead men to eat less healthy food than women. This gendered behavior can lead to greater disease among men. In this figure, we see how gender-related food intake can be translated into sex-specific basic metabolism and gene expression, and finally, into sex-specific responses to dietary intervention. Nutritionists have used sex analysis to explore, at the functional mechanistic level, how nutrients affect gene expression and cell function in women and men. In one study, they examined vitamin E gene interactions affecting the incidence of respiratory tract infections in the elderly. The main findings suggested that the effect of vitamin E depended on sex. Only in women with a certain genotype did vitamin E reduce respiratory tract infections. This case documents that studies designed to analyze how sex and gender interact, one of our key methods, can provide rich data for interventions to promote healthy living and better aging.